Hi, my name is Amisha, and today I'm going to talk to you about breastfeeding with Candida albicans and an infant who has cleft lip. I'm going to use the situated decision framework model to cover it. So first of all, I'm going to go through knowledge, risk factors, physiology, and pathophysiology, and expected outcomes with oral thrush, breast thrush, and cleft lip. So, physiology, pathophysiology, about half the population carries Candida albicans' normal skin and intestinal flora. When the balance of this is disrupted in the body for some reason, it becomes pathogenic. An overgrowth can occur, especially in the presence of human milk, as they thrive in warm, dark, moist areas, and there's lots of sugar in human milk. Overgrowth of yeast in the mouth can also occur, which can lead to, although rarely, edema, ulceration, and necrosis in the tissues of the mouth. Now, this is an image of an infant who has oral thrush. You can see the white. Now, risk factors of thrush include individuals who are immunocompromised, such as those suffering from AIDS, cancer patients, or those who are transplant recipients. During pregnancy, women have higher levels of estrogen and progesterone, which can increase the risk of yeast infection as the vaginal pH gets disrupted. Mothers are taking oral contraceptives, which are high in estrogen, and if they have deficiencies in vitamins A, D, K, iron, and folic acid, as well as long-term having used steroids for a long time, have a higher risk of developing yeast infections. Babies born to mothers with yeast infections usually develop oral thrush within 10 days. If a mother is treated with antibiotics at the time of delivery, the infant usually develops oral thrush, and if the mother is diabetic, she will generally develop yeast infections more often. Physiology: during development in utero, parts of the skull, face, and head grow together but do not fully join. That's when cleft lip occurs. There's usually a family inheritance of this. If it runs in the family, it's more likely to occur. Now here I've included a quick image of what normal breastfeeding is. Normal breastfeeding occurs when there's compression and suction. Here the infant is doing compression, and with the tongue on the nipple, the infant is doing the compression, and here there is good suction. When an infant with cleft lip has a hard time forming that suction. Now, cues. How do these things present? Signs and symptoms of oral thrush, breast thrush, and cleft lip. Oral thrush can have creamy white patches, saliva that has a pearly opalescent sheen. The baby may be extra fussy and extra gassy. They may refuse to feed, and then they might latch on for a second and pull off and start crying. They may make clicking sounds during the feed. They may have poor weight gain over time. They may have no symptoms at all. Now, breast thrush has the hallmark sign of being very painful. It'll feel like glass grinding on a woman's nipple. It can also be burning, stabbing, and if there are signs on the nipple or areola, which may not be present, but if there are, it might be itchy, reddened, shiny, cracked, sore, peeling, and she may have recurrent mastitis. That might be a clue as well. Now, Candida albicans continued. Now, you have to rule out other conditions that may mimic it because positive cultures are very hard to get. So, generally, it's diagnosed by looking at signs and symptoms. Now, breastfeeding with a cleft lip, the baby, if there's issues, the baby may make a smacking sound during the feed. They may have a weak latch. They may have milk come out of their nose. They may develop a snacking pattern where they do many frequent small feeds. The baby may have bad weight gain, as I said, or they may have inappropriate output and growth. Here is just to remember, for the first 1 to 2 days, the baby's expected output is 1 to 2 wet diapers, and then from 2 to 6 days and onwards, you should expect 5 to 6 wet diapers and at least 3 poops. Okay, now I'm going to talk about signs of breastfeeding concerns related to cleft lip related to mother. These will be related to complications involving breast milk not leaving her breast, such as mastitis, breast engorgement, and milk supply decrease. Frustration about feeding may also be voiced by mother. Now, judgment. What do we consider? Now, let's talk about ruling out other possible causes of thrush and ruling out other possible causes of breastfeeding issues that may not have to do with cleft lip. Now, thrush. So, signs and symptoms that are used to diagnose thrush. So, what we're going to use to assess thrush is a full head-to-toe assessment, health history related to alternate conditions such as diabetes or medication use such as long-term steroid use. Ask many, many questions. Vital signs such as a high temperature may be indicative of a yeast infection, or thrush mastitis can become a complication of it. You'll have a high temperature with that as well. Now, assess the latch, positioning, feeding relationship, the milk supply, and knowledge related to breastfeeding by the mother. Assess infant for appropriate weight gain and output, and blood work can be useful as per a increased white blood cell count. Now, here is a good latch and a bad latch. Bad latch and a good latch. Here, the mother's nipple is hitting the hard palate, which can lead to soreness. Here's an example of another condition that can lead to a sore nipple, either than thrush. That is why we need to assess all these different things like latch. Now, thrush assessment. Oh, I just talked about that. Other conditions that can cause or can appear to be nipple thrush are eczema, Raynaud's syndrome, dermatitis, inflammation, and fibromyalgia. Other things can also include overactive milk ejection reflex, which can be very painful, skin damage through an allergic reaction, so on and so forth. There are many things. Now, the infant may have a long tongue, and the infant, which can lead to painful latch, and also the infant may have an oral virus such as hand, foot, and mouth disease, which can also lead to a painful mouth for the infant, just like as seen with a oral thrush. Now, cleft lip. Now, for breastfeeding issues, we're going to assess the I went one too far. We're going to assess the latch positioning, feeding relationship, the milk supply, the knowledge related to breastfeeding, and with cleft lip. And we're going to look at the breasts, and we're going to look at the infant. And we're going to assess the infant for appropriate weight gain and output. For cleft lip, it's easily diagnosed at birth. Feeding problems being present may include that may not have to do with cleft lip, include ineffective positioning, inappropriate milk supply, ineffective parental education regarding gap closure, that I'll talk about in a little bit, and alternative disease processes. For example, if the baby is jaundiced and really sleepy because of that, it may not be feeding well, which has nothing to do with cleft lip. Referrals can be made. For example, if successful breastfeeding is not done, we might talk to the lactation consultant, which can be very beneficial. We also need to talk to the physician or healthcare provider, which may be a nurse practitioner, to get a diagnosis of yeast, to get a treatment option such as antifungals. Now, here are my 3 best practice measures. For number 1, treat thrush and treat the assessed breastfeeding issues that are related to cleft lip. Number 2, monitor and support the breastfeeding relationship. And number 3, educate. We want to educate all the time. Now, decisions, how are we going to treat this? So, I said here we're going to treat, monitor, support, and educate. So, how are we going to do that? Number 1, for thrush, we are going to treat mother, infant, and the partner for yeast. We're going to give topical ointment and nystatin or clotrimazole to the nipples before and after feeds, and we're going to apply nystatin suspension to the oral cavity 4 times a day using a dropper or swab. Relief should appear within 36 hours, and after about 2 weeks, symptoms should disappear. Dietary changes may be needed, such as decreasing cheese, bread, wheat, sugar in the diet. Treatment also needs to include pain management, as pain can ruin or really have a terrible effect on the breastfeeding relationship, which we cannot have happen. So we're going to teach the mom to use a nipple cover, which are like hard plastic shells between feeds to protect the nipples. We're going to give mom crushed ice to use on the nipples to numb them before feeds. We're going to get them to start to feed on the less painful side, and they can use analgesics. If it is too painful to feed, the mother can pump on low suction and give expressed breast milk until the pain is resolved. Next, we're going to talk about monitoring. So monitor for clearance and reoccurrence of thrush, monitor the breastfeeding, such as latch and relationship, monitor for effective milk transfer, and monitor appropriate weight gain and growth of the infant, as well as output. Cleft lip. For cleft lip, we're going to teach the mother to allow the baby to latch on while we get her to cover the hole of the cleft lip with her fingers or her hand. Steri strips can also be used to close the cleft lip while the infant feeds. To promote good milk supply, we're going to get the mom to pump as soon as the baby is born. We are also going to get lots of skin-to-skin contact, and we're going to get the mom to pump every 3 hours. And at every feed, we're going to get the infant to suckle on the nipple for at least 5 to 10 minutes before giving express breast milk. This way, good milk supply will be established. We're going to also follow the recommendations stated by the lactation consultant if a feeding plan was made, or if a lactation consultant was seen, if any other advice was given by her. Now, we want to also give express breast milk in most cases to ensure that the baby gets enough breast milk. Also, surgery to close the cleft lip gap can be booked for between 2 to 3 months of age. Now, for positioning, there are a few different ways of positioning that we can do to help close the gap. So, here is a cradle hold, very common. Football hold, also very common, and a face-on straddle position, which can be very useful to close the gap. So we're going to aim the nipple to the top of the infant's mouth, and we're going to close off the cleft. This one is especially good, the face-on, for a double cleft. Depending on what side the cleft is on, these two can be modified to close it appropriately and well. Now, monitoring, we need to monitor infant hydration and weight gain while the feeding methods that are best for the mom and infant are established. And if it's inadequate, we are going to give express breast milk or increase the amount of express breast milk given per feed. Now, evaluation. Finally, let's talk about what we should see. So, for thrush, we want to see that the breastfeeding relationship and all the breastfeeding involved is effective. We want a referral to have been made to lactation consultant and for the feeding plan to be verbally recited and demonstrated and followed by parents. Sorry, this is for both the cleft lip and for thrush. Okay? Pain related to the thrush should have resolved by now, and the symptoms should be cleared by 2 weeks. The mother should have a clear understanding of all the information and monitoring the infant's output, weight gain, the latch, the feeding positions, and so on. And if any complications arise, the mother needs to be able to see it and call for help. Healthcare provider should be seen immediately. Now, if the infant's cleft lip is planned to be closed, surgery should be booked. Resources should always be available to the parents, and all this information should be known by them and should be able to be recited and demonstrated in some capacity. Okay. So my main points for my overview include provide full assessments to rule out any other conditions. Cleft lip infants can breastfeed, so make sure the parents know this. Ensure the mother and infant are treated with antifungal medications and the pain is managed. Okay, we don't want to jeopardize their breastfeeding relationship. Now, we don't want them to have their breastfeeding relationship to be jeopardized. We're going to educate the mother on effective positioning and sealing the cleft lip, as well as how to ensure a good milk supply and how to give express breast milk. And we're going to have a lactation consultant come in and check in these situations to ensure best outcomes for the mom and infant. And education on prevention of complications and the recurrences of conditions is extremely important. Education is extremely important and key. As nurses, we need to demonstrate and help foster these parents to learn how to do everything they can and how to manage these conditions. That is our job. Anyways, that is my presentation, and thank you for listening.